think you know something about him already, but just to recap a few of the highlights. He was named president of the UW Health American Center to open on August 17th this year, and the senior vice president, UW Hospital and Clinics in June 2013. He provides leadership for all strategic and operational activities of UW Health at the American Center, and as senior vice president for UW Hospitals and Clinics, he provides leadership for the overall UW Health strategic plan. Most recently, before this, he was executive vice president and chief operating officer at Unity Point Health St. Luke's Hospital, a large hospital in Cedar Rapids. Prior to joining St. Luke's, he served as vice president of hospital administration at Theta Care in Appleton and at Danville, Pennsylvania's Geisinger Health System, a 540-bed tertiary and teaching hospital. He was also very much involved in developing the nation's first rural Medicare HMO network. He started his career in Pueblo, Colorado. But he's no stranger to Madison. He received an undergraduate degree from the University of Wisconsin in economics and his master's in healthcare administration at St. Louis University. John, welcome you to the podium.
Great. I want to thank you for the opportunity to tell you about UW Health at the American Center. This is the reason I came back to Wisconsin, and I'm very excited to tell you about this great project. I grew up in Sun Prairie, and my dad was a high school principal, coach, and teacher there in Sun Prairie High School for over 40 years. My mom was a nurse, and Frank would be glad to hear she graduated from St. Mary's School of Nursing, and I really feel like I channeled their careers. And so to have the opportunity to come back here and build this new facility on the doorstep of my hometown is quite a personal thrill for me. I want to thank a couple community partners, FLAD and Findorf, who helped design and construct the facility, and they were great partners throughout this process. And I really feel like it's the most exciting thing that's happened on the east side of Madison in a long, long time, even more exciting than Cabela's. So, so happy to show you. As Ellsworth said, we actually opened for patient care on August 17th. But the project's been in the making for 10 years. We bought the Greenfield site. We're located at 4602 East Park Boulevard, out in the American Center Business Park, right next to American Family Insurance headquarters. And the idea back in 2005 was that if you've been to the UW Hospital campus, we were concerned about the growth and the ability to grow on that site. We're landlocked, parking's tough. It's tough to renovate inside a facility like that. And obviously, we're taking a look ahead at the growth on the east side and beyond there in terms of the development out there. And so really the people that made that decision 10 years ago were right on in terms of the timing of this now, 10 years later, coming to fruition. So I'm excited to be able to tell you a little bit more specifically about what we're all about. So to talk to you a little bit about why we're coming together is there's really 5 big reasons why this center was developed. And the first was that we want to be a center for elective surgeries. At the UW Hospital campus, we do transplants, we do big heart surgeries, we're the level 1 trauma center. So be able to put together an efficient elective surgery schedule in the midst of all of that unexpected surgery is very difficult. And so this center is really focused on elective surgery. We want to offer another seamless access point for comprehensive UW Health services. So again, the growing east side, we want to continue to develop our resources and will be another access point for patients and families. We have the opportunity, because of this unique facility, to reach out to the communities, and that's a big part of what we're doing with the center. and strengthen UW Health through offering programs that are focused on wellness and prevention, so that we really become your partner in terms of keeping you healthy versus taking care of you just when you're sick. Another big reason was again really to free space at the UW Hospital to accommodate their master facility plan. Again, they need some room to expand clinics there, to renovate their inpatient facilities. So we'll be really relocating a number of services from that campus to UW Health at the American Center. And then lastly, this has been a place for delivery system innovation. So because of our smaller size, because of our lean management system and some of the other things we're doing with the design of the facility, we're really testing out some new ideas that we hope will benefit not only UW Health, but the rest of healthcare in terms of maintaining high quality and lowering the cost of healthcare. I'll just mention, but these were the guiding principles for the design, and really the bottom line here is that they were centered around the patient. But again, kind of using that lean management system that many other health organizations like Theta Care, where I came from, have utilized to really bring services as much as possible to the patient versus having them travel through the facility. That we really minimize wait times, so look for opportunities so that they're not waiting. That's considered waste. And that we're giving them the personal attention that they deserve, and we want to make sure that they have a great experience when they come into our care. So that's a big component of what we did with the design. The second thing is that health and well-being aspect, and we really felt that being a partner in the community, we worked with the City of Madison and our contractors to really become a LEED certified facility. So we hope to actually get a designation of silver when it's all said and done. But we've really been friendly to the environment. We have an efficient use of resources, reuse of water, reuse of materials in the construction process. So we're very proud of that, and we really feel that fits in with what we want to do for the community in terms of health and wellness. One of the things that's unique about this project is that patient and family advisors have participated every step in the way. I think that UW Health has been a leader in utilizing patient and family advisors, or the voice of the customer, in a variety of different ways throughout the system. At UW Health, we have over 160 patient and family advisors that are helping us with different initiatives. And they were involved every step of the way with this initiative, from the design all the way to more recently with the hiring of my position. They were part of the interview process. We just did scrimmages or practices for the opening day. They came in and gave us input to our workflows. So they're very much going to be a part of us going forward. So Alan Sweet, Katie Tracty, and Peggy Zimdars are going to tell you now with a short video about how they participated in UW Health at the American Center.
We view healthcare as a partnership between the providers, the docs, the nurses, pharmacists, and so on, therapists, and the patients and family.
Patients' families have a unique perspective. They have insights that often don't cost anything but make big changes.
Other hospitals are now asking us, what is it that you do differently? And we have to explain that, we sit on different committees. We're asked for our opinions frequently. If we sit quietly and don't give an opinion, one of the doctors or one of the VPs or CEOs will say, what do you think about that concept? And we really feel that our voices are heard.
Patient family advisors have been involved in in virtually all of the committees and projects associated with the center, and we are regularly preaching patient-family-centered care. So with respect to signage and wayfinding in the facility and having the lighting be just right.
We were not just on a team, we were members of the team. We were helping make decisions, we were included. If we weren't at the table, we were said, come on, get in here, sit at the table. We were building the mock-ups with everyone else.
We were so welcomed, and they were so interested in our opinion, and we met frequently. I was on a group to do a clinic floor, and so we built a clinic floor from the paper, flat paper, to little models.
The openness of the whole experience seems to invite a collaboration. It just has the feeling of a humanness to it.
It's the people that we are going to hire that are going to be there to take care of our patients the way we want to be taken care of.
The American Center culture will be patient-family centered, and the culture is derived from how the staff performs, the kind of care and treatment that the patient receives, and so on. It permeates throughout the entire facility.
And it'll be a journey, a continuing journey. It will have to be patient with each other, we'll have to learn from each other, but it can be a truly remarkable partnership.
So I had the good fortune yesterday of touring one of the patient family advisors that was on the design, and we really feel like we've stayed true to their mission with the development of this new facility. It is a $235 million project, 500,000 square feet. We will have about 600 positions employed there. 300 of those full-time equivalents will come from within UW Health, but there will be about 300 new jobs as part of this facility. And that doesn't count the jobs that were created as part of the construction process, which I think were 400 or 500 at the top of that game. So this, I think, is, again, a great asset to the community. We're really three wings, 3 centers of community health and wellness. So essentially we have a hospital wing, 56 beds, staffed by hospitalists from UW Health. All the physicians at the center are from UW Health. We have 14 operating rooms, which I mentioned is a big focus of this facility. We have an emergency department in our, what we're calling a universal care center. So it will also house our pre and post-operative for ambulatory surgery patients and other outpatient procedures. So really, in our west wing is the hospital wing of our facility. In the center wing is our clinic or ambulatory area, and we have 2 large floors of clinic exam rooms. Again, with a lot of the services brought to the patient within those facilities. We're specializing a lot on some of the surgical specialties within our ambulatory setting, but we also have cardiology, a large presence of our cardiology program at the campus. And then lastly, our Sports Performance and Wellness Center, which is largely our new services and programs focused on prevention, health, and wellness. A unique aspect of this facility is to use a lot of the state-of-the-art technology that's developing within healthcare. And this really came out of, again, this lean management system and the focus on minimizing wait times for patients. So there is now radio frequency identification technology, and we've been using this at the Digestive Health Center on University Avenue for the past couple years. But essentially, all associates, patients, and physicians that are working in the center will wear one of these Service Connections badges, and in real time we can look at information that is presented on screens in the facility as well as our workstations to be able to monitor the patient flow through the facility and look at where there's bottlenecks in real time so that we can address those in terms of resources, and also provide us reports to step back and look at our processes, again, to focus on cycle time and how we can reduce patient waits through as they work through the system of our services. So that, I think, is a unique thing that UW Health has done at the Digestive Health Center, and obviously we're implementing it in spades at a larger facility. Another interesting piece of technology we will be enhancing here to continue efficiencies in healthcare is there are many consultative services that will be on site, but many of our services are only needed, say, infrequently or once or twice a week. And so this facility will take care of an intermediate level of type of patient. But we have technology now where we can press a button and have our EICU, which is located on University Avenue, that staffed by an intensivist and a nursing staff 24/7, 365. We can have that resource right there in your room at the American Center if you are getting sicker or you need additional support and care. Same way with consultation services, or if your primary care physician wants to check in on you, we have now the capability really throughout the American Center to do those consults via telemedicine. And UW Health has been doing this with other community hospitals, but this is really the first time we're doing it within our system. And so all of the specialists have something new to learn in terms of utilizing this technology. But as we've tested it out, it's amazing what it can do, and we think this is a big part of the future of healthcare. One of the things we talked about was a focus on keeping people healthy, and we have a whole wing focused on that. Obviously, we will continue to have comprehensive rehabilitation services, so helping people when they're injured or they need therapy or other services. But we're really trying to promote now a number of wellness services that we'll be offering in this facility for the community, classes, programs, other things that we want to take out into the community as well, focused on healthy lifestyle, healthy eating. We have resources like a demonstration kitchen where we can focus on sports nutrition for athletes, or how we can be more nutritious in terms of working with our cardiologists and other things in terms of the diets that they want to implement with patients. So a variety of different things we're going to be able to do at this center, and it's a quite remarkable facility. We have always been the sports medicine provider for the Badgers, and we are really trying to take that one step further. So we've learned a lot in terms of injuries, and through that process done a number of research on this. And this facility will bring those resources now to athletes post-injury or pre-injury to really keep them healthy, keep them productive, and enhancing their performance. And this is really for anyone of any age, 7 on up to 80, whatever sport you're interested in, or if you're just in conditioning, we'll have the resources for you there. And it's really tailored after the resources of an elite athlete. So we have essentially the resources that the Badgers enjoy in terms of the facilities, and now we have the expertise that we can bring to programs, classes, and other services to the communities surrounding us. And this, I think, is very unique in terms of, again, our ability to have our sports medicine physicians working very closely with our other experts in training of the athletes. So this is a very exciting part of the American Center. As I mentioned in the clinics, we're really focused on ambulatory surgery, or surgical subspecialties in the clinics, general surgery, orthopedics. Our medical and surgical weight management program will be there, so bariatric surgery. As I mentioned, cardiology, urology, and men's health. And we'll have all the supportive services there for an ambulatory center. As I mentioned, we have 14 operating rooms. We'll be opening 11 on day one, and really we're focused on minimally invasive elective surgery. As I mentioned, our surgeons that do this type of surgery can really specialize in this at that center and really focus and be much more efficient in terms of delivering that care at a facility that just focuses on elective surgery. So our surgeons are very excited to work at this new facility. It's a great facility, a great campus that we're developing there. It's a very healing, quiet environment for patients and families. It's very easy to access once you learn where it is. We have 1,100 parking spaces, so both surface and parking garage. We have rooftop gardens right off of our restaurant, so we'll be able to actually grow our own herbs and produce that we will use in our kitchen. We've had a number of art pieces from artists, local artists throughout the area. And again, I think Flad and Findorf have done a great job in just promoting a very healthy healing space for us. Coming soon is the UW Health Rehabilitation Hospital, which is right across the street from the American Center and really complements the services that we're going to be providing at the American Center. That facility will open October 1st, and we are relocating our inpatient rehabilitation unit that's at the Highland Avenue campus to this facility and then adding additional beds. So it'll be a 50-bed facility focused on inpatient rehabilitation. And again, our physicians will support that initiative. And we're also very excited about having that develop on the east side. So it is also poised for growth in terms of those types of services. So we're really, we're very proud of the campus that we're developing there on the east side. This is exciting. So we've come up with a couple of grand opening events, and we want to invite all of you that are here today to these events. And this is a fantastic facility, and you really have to see it to believe it. We have a dedication and ribbon cutting on Friday the 31st from 10 to 1 p.m. So if you'd like to come and participate in that, and then have there'll be self-guided tours and things like that to see the facility, we'd welcome you all there. And if you can't make that, we have a public grand opening on Sunday, August 2nd from 1 to 4 p.m. And we will be offering a number of insights into the facility at this time, but we also will have 3 celebrity guests we're very excited about. So Donald Driver, former Green Bay Packer and Dancing with the Stars champion. Sam Decker and Josh Gosser from the UW basketball team. I really tried to get Frank Kaminsky, but he's, I guess, busy with the White Sox and other things that he's doing. So, but we're excited to have those 3, and so we, please have you and your families come out to that event. So with that, we always try to end our interactions at the American Center with, is there anything else I can do for you, and what questions do you have? So we fancy ourselves coaches, so Vicki Hill and Wendy Horton, 2 of the executives that work with me, are here today, and we'd be happy to answer any of your questions.
Thank you for your presentation. It sounds as though getting to and from your campus depends primarily on the automobile. Do you have a plan for public transportation, particularly high-speed public transportation?
High speed, okay. No, no plans for high speed, I don't think. But we do have a metro bus stop that's right in front of the facility. It's already there. The bus route's been running for a few months, so we do have metro bus service out to the facility. If you're familiar with the American Center Business Park, there's lots of walking trails and other things available out there. Obviously, we have resources at the facility for bikes, for electric cars, things like that. And obviously, a lot of our staff who live on the east side of Madison are very happy to be able to bike to work versus drive to work. So I think a lot of that will happen.
Well, I'm Carol Cody, and thank you very much for your presentation. Very impressive. And I've noticed, and particularly impressed with the focus on prevention and maintaining health and wellness. And while you wouldn't do that, and you would be encouraging that anyway, it seems to me that this is a part of the framework of the Affordable Care Act. And I'm wondering if you use the Affordable Care Act at all to design this concept of delivery of health care. And then the second thing with the Affordable Care Act, and I think on the timeline, 2015 is even the year where more focus is going to be put on moving from payment for procedure and service and moving into value or results oriented. So will that be part of the way in which you try to hold down healthcare costs?
That's an excellent question, and you almost answered it for me. But the answer is yes. Population health. Madison is unique, and our organization is unique in that we do have our own insurance plan, and so we're capitated. We're at risk for managing the care of patients. So clearly, even though these services haven't historically been paid, a big part of our job is that focus on prevention and keeping people healthy. And I think if you come to the facility, you'll see it doesn't feel like a traditional hospital. So we're anxious to hear your ideas about how to do that, working with you as folks. And so definitely the ideas of population health and how to manage a population is clearly a big reason for this initiative. The other thing I would say related to the Affordable Care Act is that one of the things they just recently announced was that they're going to bundle the payment for the hospital and the physician into one payment. So they'll just pay us one fee for both the hospital and the physician services. So we will be uniquely positioned to do that at the American Center for, say, complex surgeries like joint replacement. And because we're part of an integrated system, we can, again, create efficiency to do those elective surgeries in a very cost-effective manner. So that was also part of the thinking, which was really driven by the Affordable Care Act.
Thank you. You partially answered this, but I just moved up here from Illinois with healthcare for 50 years, but it was even reported in your own paper that Madison is the 5th most costliest city in the country for healthcare. And it would appear to me it's because it's mostly corporate healthcare, but how do you address that and how would you make any changes?
Well, I'm not totally familiar with your study, but I think in terms of the quality of care that's provided in Wisconsin, I think we're one or two in the list in the country. And sometimes, folks get confused between what we charge as a healthcare organization and what it actually costs to provide that service. And when you look at UW Health and the types of services provided, and we benchmark ourselves against other parts of the country where we see ourselves as very cost effective. On the other hand, that's a big part of this initiative, is to create an environment where we can lower the cost of healthcare, that we can look at cross-training, different ways of utilizing resources so that we can bring the cost of a unit of service or a surgery or whatever the case may be down. So you know, it's a work in progress, but we feel very comfortable we're moving in the right direction.
Okay.
Thank you.
Thank you. Thank you again very much. We are adjourned.